cut in half the unnecessary prescriptions for antibiotics within 4 years. But many doctors say that they're pressured by parents who want antibiotics for their sick children.
Frankly, it gets easy to write a prescription and send someone out than to spend 20 minutes explaining why you're not going to do it.
But they may not need it.
They may not need it.
When might antibiotics be needed? Well, doctors say when that ear infection has pus in it, when a sinus infection lasts 10 days, and when pneumonia accompanies bronchitis. Well, we wanted to know about this more in depth. Is overuse a problem in Idaho? And what do we make of research that says 47 million prescriptions given out each year are unnecessary? So to get to the bottom of all of that, we want to turn to Dr. Anjum Fazlani, who is an internal medicine physician with St. Alphonsus. Welcome to the program, Doctor. So what do you make of that claim? Initially, the claim says that 1 in 3 prescriptions for antibiotics is unnecessary. Do you agree with that, Doctor?
Center of Disease Control published a document in 2013 that was called Drug Resistance Threats in the United States. 2 million people have infections which are resistant to antibiotics, of which 23,000 patients died directly related to that. So it is an issue, and that is causing more and more problems in both inpatient and in outpatient settings.
What about here in Idaho? Do you have numbers as far as where we rank with antibiotic use?
I think Idaho has done an excellent job with the outreach programs and with community-based educations, because the numbers are much less than the national average. So the incidence of drug-related infections or resistance is much lower in Idaho compared to the other parts of the country.
And the map was showing that we do rank low when it comes to that among the nation. We mentioned that doctors are feeling pressured by parents because they want those antibiotics. Do you think that is the underlying issue?
There are many reasons, but one of the reasons is that understanding that an antibiotic is not going to act against a viral infection, and it's a different kind of infection. So a lot of time when parents are bringing their kids, or they're coming themselves, they've had this cold for 3-4 days and expecting that the antibiotic is going to take care of that. So by the time they take the medication, it's 7 days, and that would be the natural cycle of a viral infection. So I think that one of the big piece is viral infections being treated as bacterial infection, or that the patient's and the physician perception of this being vice versa.
Well, so as a parent, I have 3 young ones. We are in the doctor's office a lot. What do I need to know as a parent? When should I expect to get an antibiotic, and when should I not?
I think the American College of Pediatrics has released a position paper on this, which has information both for parents as well as for physicians. And usually it relies on the duration, number one. So if you've had an infection or something that's gone on from 8 to 10 days, the duration tells us that it's going out of the range of the natural cycle or the life of a viral infection. Then objectively on examination, what is there pus in the eardrum, or is there any other findings suggestive? Because earache most likely is not going to be from an ear infection requiring antibiotics.
Really?
Yes.
Say that again. Listen carefully, say that again, really.
Not all earaches are going to be secondary to ear infections, and I think doctors, especially in the pediatric population, are getting more comfortable, and patients are getting more aware, families are getting more aware that just because I took my kid in at 6 days does not mean the child needs an antibiotic.
Okay, it's okay to go home from the doctor's office without a prescription?
Yes.
Okay.
But the evaluation is what should give them the comfort that the doctor saw the patient, there is nothing in the ear that suggests a bacterial infection. It can be fluid, it can be a viral infection that's going to run its course.
Again, let's talk about kind of the dangers of why we're talking about this, the overuse of antibiotics. I mean, I could see where a parent is thinking it's not going to harm Johnny or Susie if they have an antibiotic. But what is the long-term damage to this, or the consequences maybe?
Yeah, when we started using the current antibiotics in the 1940s, it was a life-saving drug. Over a period of time, the more we have used it, that the organisms or the bugs have become adaptive and they have become resistant. And a lot of infections, hospital-acquired, whether it's from diarrhea, urinary tract infections, some of those have become resistant to your common antibiotics. Just from C. difficile colitis, which is a diarrhea, an infection caused by the use of antibiotics, 250,000 people in 2013 by CDC's estimation had this infection, and of which about 13,000 people died. So use of antibiotic is not as, it's causing a lot of problems. And, like at St. Alphonsus, our inpatient unit does an excellent job of picking up some of these things. They don't wait for the cultures or the results to come back. Person comes in for diarrhea, they go in a protocol or the process that is for patients who might have C. difficile infection.
I was just going to ask in particular what St. Alphonsus might be doing to correct this, if you will. Any other, while I still have you, any other final take-home points for parents or grandparents watching this?
I think the biggest take-home is that antibiotics are not the treatment for every infection.
Okay.
Viral infections are more common, and the antibiotics are not going to do anything other than treating a bacterial infection. So the duration of the symptoms, if you've had a cold for 5 to 7 days, it's okay. It's going to run its course.
Run its course.
And let it run its course. And if you go to the doctor's office and they're advising symptomatic treatment, it is okay to do that, because the more you get exposed, and plus taking the antibiotic is not going to work when it's not what's causing the problem.
Well, this is important information. Thank you so much for this. I know we've learned a lot. I have. Dr. Fazlani, internal medicine physician with St. Alphonsus. Thank you.
Thank you.
And we'll be right back with more of the News at 4.